I've been here a little over 12 years. I came in February of 2002, and it's been a very quick 12 years.
So what state do you remember the Children's Hospital being in when you arrived? And then if you can walk us through sort of how you saw it evolve.
It was in a planning state for a freestanding children's hospital at the Kluge site. A lot of enthusiasm about having a children's hospital in Charlottesville and Central Virginia, but quite a bit of frustration about the lack of progress toward making what has been a long time dream, maybe a 30-year dream, a reality here in Charlottesville. And so very early on, Peggy Quayle, Barry Battle, Bob Chevalier put the challenge in front of me of perhaps one of the things I should do during my tenure here is to make that dream a reality. I'd have to share with you, though, that as I looked at it, my conclusion was that that dream could never become a reality. It could never be afforded in terms of its construction, and I don't think that any of the projections that I was able to work up, it could ever even break even in terms of operation, because it just didn't have the scale that it needed to become operationally viable. So I really had some not so good news to deliver to all of the community who had been waiting so long. But I also said that the exchange for not having a completely freestanding children's hospital was an option on reality, not just a dream, but make that dream come true. And the reality was achieved by bringing it here on main grounds, connecting it to all of the resources like operating rooms and dietary services, medical records that the main hospital had without having to duplicate those. Perhaps most expensive two areas were operating rooms and the emergency room, as well as imaging. And then create really an anchor for the UVA health system, or the medical center as we called it then, around the Children's Hospital by locating it on the corner of JPA and West Main. But that really meant a shift in people's thinking. And I recall a number of challenges about being a real children's hospital if we weren't freestanding. But as we're beginning to see now, the free-leaning children's hospital, as it's come to become known, is really a wave of the future. And so many of the children's hospitals are having this outpatient focus, which is where care for children is going. I recall as a youth just having my tonsils removed, how frightening it was. Hospitals are frightening for children. And so, you know, that care is changing, and of course that fits right into what children's needs are, a comfortable family environment that we're able to achieve with the Battle Building.
So let's talk about...
When I arrived here in 2002, what I observed was a dream for what is called a freestanding children's hospital. That's an idea that was developed back in the 40s that has all of the services that you need for children, both inpatient and outpatient, under one roof. It's separate for everything else, with the belief that children needed everything unique and different from adults. And of course, constructing a facility like that is very expensive. Running a facility like that is very expensive. And my observation was that that dream of the freestanding children's hospital wasn't likely to ever become a reality because we'd have difficulty with creating funding to build it, and we could probably never make it operationally viable. And so I felt I had some difficult news to share with the community and with the advocates, Barry Battle, Peggy Quayle, Dr. Chevalier, Nancy McDaniels, Sharon Hostler, about how we might make this dream a reality as opposed to a continuing dream for the community. And the way we were able to do that is to create this concept of a free leaning, meaning outpatient services all under one roof, but physically connected so that the inpatient services like beds and ORs and imaging and the emergency room are available in the main hospital. And so all of the services children need are interconnected, but all not under a new freestanding children's hospital. And that was a very difficult conversation, as you might imagine. Time out. And because it really didn't fit with what people envisioned as a children's hospital. But it was, in my view, the only way that dream was to become a reality. And paying for the construction of a $100 million plus facility was no small undertaking. And the way we've been able to achieve that is to relocate outpatient surgery in the lower level and utilize the revenues from outpatient surgery to help pay for the construction of the new facility. We needed a new outpatient surgery center. We were outgrowing it. And so we could use both the operating revenues as well as the capital by combining those two needs into one facility. We felt we could do it because so much of outpatient surgeries for children anyway, it would be under that roof. The new construction, once you dig a hole, it's a matter of adding a few more rooms and consolidating all your outpatient surgery. And with the generosity of the community, the Ivy Foundation, and some hard-earned dollars here at the hospital, we've been able to make that dream a reality. I came in February, and that June I attended my first telethon. And it was held here in the classroom in the gymnasium on the 7th floor. And it was amazing the enthusiasm and warmth and just love of the concept of the Children's Hospital. If I would have put a tag on the new facility, it'd be the house that love built. And you know, generosity came in $5 million gifts and 50-cent gifts from children who were part of some of the walk events. You know, this wasn't a one and done. I think the fact that achieving this dream was a 30-year journey, and it had so many fingerprints all over it, has really made this a special facility. The folks who are a part of it, both our staff and physicians, as well as the volunteers, have so much affection for what we do. And what we do are create miracles every day for our children. When a child has an illness, you know, serious or otherwise, it involves the whole family. It involves the parents. It involves the siblings in a way that adult care doesn't. And so what we need is a recognition of the needs of not only the child, but also the entire family. Special waiting areas, play areas for siblings. We also have to understand that sometimes the needs of the children are going to take quite a while to address, either cure or resolve. So we need to recognize that they're not only growing bodies, but growing minds. And so education is a very important part of what we do. And our educational program here is as good as any school system in America. It just focused on children with illness.